morning. Welcome back to the Retirement Report. I'm Hank Parrott, your host. Joining me today, Warren Cranford. He's a benefits specialist. When it comes to Medicare, this is one of those areas that we're going to share with you some different resources. And again, this piece from Nationwide Retirement Institute. But the other is someone like Warren can help you when it comes to understanding how Medicare is going to work for you, whether original Medicare or Medicare Advantage plan might be best, what kind of supplement you might need, and how much, all the different costs for these. And it doesn't cost anything for those services. These companies that provide these products, these Medicare Advantage plans as well as Medicare supplement plans, they pay Warren. So for you, there's no cost to whether that's reassessing your current situation or if you're coming up on age 65 and recognizing that you need to make some choices here. We're going to help you with that, and he could be a great resource for you there as well. So what is Medicare and when do you enroll? Let's start with that. Medicare is a federal health insurance program. It's for people age 65 or older, or those who are disabled or suffer from certain diseases. Okay, so who is eligible for Medicare? And Warren, this is an area where first that key age of 65, but let's talk a little bit more about others and who in general would be eligible for Medicare.
Well, you have to be a current resident of the United States, either U.S. citizen or permanent resident having lived here for at least 5 years prior to applying. There are quarter credits that you would know if you qualify, calling into the Social Security office to see if you're eligible for Medicare benefits, and they would clarify all those details for you. And that's where folks typically start. You can enroll online by setting up your online registration through Social Security office, and it has a link through it to be able to register stuff. But if you're turning 65 and you meet all the criteria, someone who is younger than 65, if they've been on disability for 24 months, they would automatically be eligible for Medicare benefits, and so those folks are the ones that are eligible for Medicare benefits.
Okay, let's talk about the initial enrollment period. So there's basically like a 7-month. When you've got your birthday coming up, your 65th birthday coming up, you've got a 7-month window there. We'll go ahead and get that slide up, and it shows basically 3 months before your birthday, your birthday month, that is. So if you were going to be June is the month you would turn 65, then what would that be? March, April, May. So the 1st of March you could start, you can enroll to the 3 months after, which would be, of course, the end of September. All right, so you'd be coming up this month if your birthday was in June. And so during this period, you've got a lot of choices to make. If you've already collecting Social Security benefits, you're automatically going to be enrolled in Medicare Parts A and B starting the first day of the month you turn 65, unless your birthday is the first of the month, in which case Medicare coverage will begin on the first day of the previous month. All of these things, Warren, they can learn just through going to Medicare.gov, among other things, right? And of course, again, if you're coming up, if you know you're going to be turning 65 soon, okay, say even within the next year, it's not too early to start thinking in terms of planning for that. And for those of you that are already on Medicare, again, this is a time that you want to understand your current plan, maybe better understand. If you've had, I've had people come in and they say, well, I like my plan, I've never had to pay anything out of pocket. Well, they not necessarily have had a lot of different health things that would have required that. So understanding before the event happens that could cost you out of pocket is a very good idea. So, and in understanding too, there are those that are going to continue to work, like past the age of 65. And if you're working past the age of 65 and you've got health insurance through an employer, now you've got some options. Warren, so if someone's 65, they don't necessarily have to sign up for Medicare, right? If they have health insurance through their worker or their employer.
And let me just take a second just to reiterate, clients that call me and stuff, they will call me sometimes 6 months before they turn 65.
Right.
And that's really not too soon. I encourage folks not to wait and make that phone call, touch base with someone that you trust to be able to talk about that process and stuff. So in the scenario you were talking about, folks that are on Social Security already at those 3 months prior to when they turn 65, yes, they typically would be receiving their Medicare ID card. I encourage clients, if they're talking to me, they haven't received within the first 2 months prior to their birthday month to make a phone call to the Social Security office and just double check on it. But I get a lot of phone calls. Clients will say, hey, I'm still working, I'm on my wife's insurance, or I'm working, I have group insurance. And in that process, what's really important to remember is that what your options are. Communicating with the company's HR department to find out what their policies are. There's a lot of details there about if you stay on the insurance, some companies require you to roll off or a spouse to roll off. Those are all things you need to know about from the company's HR and policies and things. And so contact them and learn that. That's a lot of information that will be helpful to whoever's working with you or to you through this process. But yes, if they have 20 employees or less, then there's guidelines and rules where Medicare is primary insurance if they sign and enroll in Medicare and as Medicare's benefits, and they stay on the group insurance policy, it becomes secondary, and vice versa. If they have more than 20 employees, then the Medicare insurance could be primary, and I'm sorry, I have it backwards. If they have 20 or less, the Medicare insurance is primary, group insurance is secondary, and vice versa. If they have more than 20 employees, the group policy is typically first, and Medicare is secondary stuff. So, and there's ways to avoid penalties, especially around that. If someone wants to delay Part B, you can. For most folks, Part A is free. There's no cost to Medicare Part A. And so clients, I will guide them through that sometimes. That's the way they want to go, and it's the best fit for them. They just enroll in Medicare Part A when they call in and enroll in Medicare, and they delay Part B. And those things we can get into and guide folks as they're trying to navigate through that period of time.
Yeah, in fact, we're going to talk about what the different parts of Medicare are, what their coverages are, what the coverages are for these different parts of Medicare, and what the costs are as well. One of the things when it comes to understanding with any of these, all the complex things that you're going to have to deal with as a retiree when you're talking about decisions with regard to Social Security, understanding how Social Security benefits are taxed, understanding other things, means testing, which could increase Medicare premiums as an example, or reduce your benefits. And this is what all this is doing, is about reducing benefits, right? So for instance, between the age of 62 and your full retirement age, depending on, again, on your date of birth, 66 to 67 range, between those years, if you start taking Social Security and you're still working, means testing is basically saying, well, if you make a certain amount of money, and I think it's around $19,000 right now, for every $2 over that $19,000 that you make, you're going to have to give back basically $1 of your Social Security benefits are going to be taken back, so or reduced. So this is one of those areas, again, it's very important to understand how these rules work to help you with your planning. And Medicare, the same thing. Depending on how much money you make, you might pay more in Medicare premiums than someone that makes less. So when you're thinking in terms of your Social Security benefits and you're looking at that statement, you know, SSA.gov, by the way, if you want to go in, if you haven't already registered, register online. You'll be able to then check your, because they don't send out the paper statements anymore, I don't think at all, or if they do, it's rare. And with that, you can go online, though, at SSA.gov, Social Security Administration.gov, SSA.gov. You can go on there, you can register, and you can be able to look at your statement 24/7 if you like, see when it changes each year, that kind of thing. So when you're looking at it, though, one of the things I want to caution you, when you're looking at, in particular, at the earlier years between 62 and your full retirement age, understand, again, how much of that money are you really going to get to keep? And even after full retirement age, or if you're not going to be working and you retire early and start taking Social Security, Security, you still have to worry about your benefits being taxed potentially. And if they're taxed, that means more of, they're paying you a certain amount and they're going to tax you on it, and you got to give back some of it. Okay, so watch out for these, and as well as we're going to talk about Medicare, in particular the premiums and how much they can be affected by how much you make. And in particular, let's say you're not working but you sell a property or you sell off some stocks. The capital gains from those could cause your premiums, right, to go up and go up substantially. So it's something to understand before you make decisions. Get educated, be informed about how these things work. All right, there are two options for Medicare. So let's take a look at this next slide and talk about the difference between original Medicare and a Medicare Advantage plan. So basically, Warren, there's two major options for Medicare coverage. Think of them as two paths to choose from. So whether you're married, single, divorced, or widowed, everybody enrolls in Medicare as an individual, and that's an important piece. And I think in particular with couples, when they're used to being, like for instance, they both may be on the same health plan through work, and when you're adding the second person, it's typically less expensive than your primary carrier coverage. However, with Medicare, it doesn't work that way, right?
Exactly. I think one thing that's really important to point out here is that sometimes there's a misnomer. I know that we pay into the Medicare system in our lifetime and things and stuff, and people sometimes ask the question, well, why do I have to pay a Part B premium and things like that? But Medicare is not free, and unfortunately that is the state. And so each individual person at the time that they choose to go down, like you said, there's two paths: an original Medicare or an Advantage plan, which are the paths you can choose, and on those paths you have multiple options within on those two paths. But yes, each individual does have to enroll and choose their own path and plans, et cetera, when they are eligible for and move to the Medicare benefits for their insurance coverage. So,
and like you said, it's not free. So whether you're talking about the combination, there's a premium cost, just like insurance in general. If you've got if you've got life insurance, if you've had health insurance through work, you probably paid a premium there. Disability insurance, car insurance, all the different insurances we buy. We are paying a premium for those. Medicare is no exception. And then, as you know, with your health plan at work, this is going to also be familiar in that you also have deductibles and copays. So you're going to have additional, in addition to the premium, you're going to have other costs that go with that as well. And then when you're looking at these, Warren, on the different parts here, Part A, for instance, for hospitalization, now that's the one that doesn't have a premium cost. You still have deductibles and copays, and this is where people that are still working might, in continuing to work and be covered under their health insurance, may in fact add Part A at no cost and have that. And some, I think, employers require that they sign up for Medicare because they want that offset, I guess. Part B, on the other hand, that's the one that has a premium. And what's the premium for Part B?
Yes. So in 2022, right now, currently the premium is $170.10. And typically those premiums do go up each year, and we won't know what those amounts are until the end of the year. But yes, right now Part B premium is $170.10. The average, and that's what the average U.S. citizen pays. Hank, that is one area of Medicare that, as far as costs are concerned, that based on your income, you could potentially pay a little bit more, or your income pay less. And those are the kind of things that, folks, if you're working with someone, they can help you, guide you through your eligibility or your responsibility, depending on what that is and stuff. And the Social Security office can give and guide you with, give you information for what the cost of your Part B premium would be. But you're right, Part A is the free part of Medicare, the original benefits.
Excellent. We're going to take a quick break. When we come back, we're going to delve in and talk to you about Medicare Part D, Part C, also referred to as Medicare Advantage plans, how these work, what premium costs might look like there, and the difference in coverages as well. So pay attention. Right? Get your pen and paper out. Be ready. We got a lot of good stuff for you. All right, join us here. We'll be right back on the Retirement Report.